20 programs. But today we will take a deep dive on how Volunteers of America addresses the behavioral health needs of the most vulnerable in our community. This is important work because by working with clients as they struggle with mental health issues, we are preventing people from getting caught up in the criminal justice system, while at the same time reducing visits to the hospital emergency rooms and other facilities. Most importantly, by doing this work, we are aligning with our mission of helping the most vulnerable by working with them and empowering them to a life of dignity. I would like to now introduce Volunteers of America Southeast Louisiana's President and CEO, Jim Leblanc. Hi, Jim.
Hello, Isabel, and thank you so much for doing this morning, but thank you so much for your service on the board of Volunteers of America here in Southeast Louisiana. I too want to welcome everybody aboard. I see we have over 40 participants, and it's just great to have you all here. Thank you very much for joining us for our first community forum. I would also like to give a special thanks to Louisiana State Representative Royce Duplessis. He represents District 93. Thank you, Royce, for being with us. And also Miss Chloe Wiley with the Blue Cross Blue Shield Foundation. She and Royce will be panelists today after we hear from our presenter. And I'm just, someone else will later more properly introduce Melissa Haley, but I just want you all to know that I have worked and known and worked side by side with Melissa for over 15 years. And we are both very, very, very proud of our social work lineage. I think Melissa is just an outstanding representative of the social work profession. And I say that even though she refers to me as the old social worker in the group. So she's not the old one, she's the young but very experienced social worker. But I'm just so glad that we have an emphasis on social work, and in particularly as it relates to behavioral health. And the idea of a community forum came about because our Director of Development, Charlotte Dogie, and our Director of Government and Community Relations, Nick Alvarez, were thinking of ways of how do we educate more people about what we do at Volunteers of America, but more importantly, how do we let them know about community problems that we are all facing as a community and what Volunteers of America is doing to try to assist with that. So that's led to our community forum here today. Just a little bit more about Volunteers of America. As it relates to behavioral health, we serve almost 1,000 people right here in our 16 parish area of Southeast Louisiana. We also have 2 other chapters or affiliates, if you will, in Louisiana of Volunteers of America. And they too work with, I'm sure, hundreds of folks struggling with behavioral health issues. And, you know, our work is typically, usually real hands-on. We work with people face to face. And of course, with COVID-19, that really changed. We had shutdowns and we could not continue to deliver services as we were normally doing. But thanks really to state officials and federal officials, we were able to switch over to telehealth, and people have continued to get service. And folks, that's just critically important. And we've become aware as a society, I think, of the connection with primary health to behavioral health and mental health and addictive disorders. So we're trying to do things with folks to be able to help the whole person, and also hopefully avoid unnecessary hospitalizations and emergency room visits. So I am I'm real proud to be part of this. I am wrapping up a 36-year career with Volunteers of America at the end of the year. And it's just been an honor and a privilege for me to be involved with this organization and to get to know so many great people, some of whom you will hear from today. With that, I want to turn this over to Mr. Nick Alvarez, who is our Director of Government and Community Relations. And Nick, here's to you.
Great. Thank you so much, Jim. Good morning to you all, and thank you all for joining us for this community forum. I'm really looking forward to these presentations and to the discussion that we're going to have this morning. To start us off, I'm going to walk us through our agenda for the hour that we have together. So to start off, Melissa Haley, our Director of Supportive Services for Volunteers of America Southeast Louisiana, is going to talk about how her program responds to the mental health challenges in our community, with a particular focus on how 2020 has impacted those services and how we've had to adapt. From there, State Representative Royce Duplessis of House District 93 is going to share his reactions to Melissa's presentation and also talk about how state policy can respond to the challenges that we're facing as a society. And then Chloe Wiley, the Foundation Initiatives Manager for the Blue Cross Blue Shield of Louisiana Foundation, will share how philanthropy plays a part in responding to the multiple challenges we're facing. And then we're going to have a discussion. I'll open it up, and actually you can go into the chat and share any questions that you have throughout the presentation, and I will take those questions once we conclude with all of the speakers. So let's get started. Melissa Haley is the Director of Supportive Services at Volunteers of America Southeast Louisiana. She manages our behavioral health and permanent supportive housing programs. She, over her 15+ year career with our agency, she meets families when sometimes they are in their lowest situations, in crisis, facing homelessness, facing behavioral health challenges, and substance use disorder, and helping people recover from disasters. Melissa is a proud graduate of Xavier University of Louisiana and Clark Atlanta University, where she received her Master of Social Work degree. She currently serves as the interim president of the National Association of Black Social Workers, and she is a force for good in our community and a fierce advocate for the most vulnerable. With that, Melissa Haley.
Good morning, everyone. How you doing? Thank you for spending this hour with us talking about something that I love and I'm extremely passionate about. I'm a second-generation social worker, so I was raised by a change agent. So literally my whole life, I've been surrounded by missions in motion, right? Missions in action, seeing people do what they're setting out to do, what the goal is of their organization, really helping to make a difference in people's lives. I've had the pleasure of working at Volunteers of America for 15 years. And at this agency, for over 125 years, we worked in the community, helping the most vulnerable people in the community. We do so with innovative services. We reach out to the most vulnerable individuals in the current state they're in. We meet them where they are, in the community, and we utilize our expertise in order to help them change their lives. To do so, we have credentialed staff. We have people, over 40 social workers on my staff with master's degree in social work. We have licensed mental health clinicians who have very manageable caseloads where we can do intense case management to individuals that we can see what each person needs. It is not a one-size-fits-all. We work very hard to deal with severe mental illness, co-occurring disorders with multiple populations. We service those with intellectual disabilities. We service veterans, children and youth, people throughout of our community. We do a holistic approach to ensure that the whole family gets the services that they need in the situations that they need coming to the community. Additionally, we've changed a lot over the years. If you notice, you haven't heard anybody say mental health, right? Mental health, when I was a social worker, and I've been a social worker for over 25 years, so mental health was all we talked about. Behavior health was not even on the chart. In Volunteers of America, about 8 years ago, the decision was made to no longer to be a mental health organization, that we're going to be a behavior health organization. So thus, my title is Supportive Services, because we don't focus on the pathology that comes with mental health. We focus on the behavior that can help you have a healthy lifestyle. So when you hear the difference, there is a major difference between mental health services and behavioral health services, but basically we want to look at the whole person, not just the diagnosis, to see how it impacts your activities of daily living as well as your quality of life. Additionally, we service 700 individuals currently, and Jim said 1,000, and what was interesting about that is that we terminate individuals once they reach their goals. And once they reach their goals, they move on and they have progressive lives. Our goal is not to keep clients forever. Our goal is to help them identify their goals, help them to meet their goals, and to move on. Right now, we have over 700 active cases, and hopefully by the end of the year, we'll be able to cut that number down and make services to new people who are in need of services in our community. Persistent and severe mental illness is behavioral health, and a lot of people have a lot of co-occurring disorders. Some of them have substance abuse issues. Many of them have health issues. So sometimes you'll hear terminology because when you may not know that people with schizophrenia are likely to have problems with diabetes as well as cardiovascular issues. We help individuals with overall wellness to identify housing and to build a support system where you have a community within your community to help support you so you know your neighbors and you know the area in which you live and find support. Additionally, you want to know, what do we do exactly? We keep people out of jail. We help people in hospitals. We stop people from having challenges within their lives in order to help them be safe and live well and be stress-free in their environment. So many people that we deal, we meet them at their lowest point, when they're facing eviction, when they're having challenges with substance abuse issues, and we help to avoid or help them navigate some of the systems that cause them challenges. Now, during COVID-19, we have noticed, and it has been a serious correlation, obviously, because I know a lot of us are experiencing some level of stress and anxiety even when we go into the community. Something in February we did very easily, but now in order to go in the community, you have to have your gloves, or you maybe have a mask, or you have hand sanitizer. All of those things can bring about a certain level of stress and anxiety. And if you Google behavioral health and COVID-19, the data is astonishing in terms of the level of stress and discomfort that people are experiencing. So right here in Volunteers of America, this was the numbers for Volunteers of America, not Volunteers of America, the state of Louisiana, over 5 days ago. Now the numbers are increasing daily. When I created this slide, we were servicing over 9,200 cases. Now we're servicing nearly 9,400 cases of individuals who have either tested positive for COVID-19 or come in contact with somebody in COVID-19 and have been instructed by the state to be in quarantine, right? They need to stay in an environment for 14 days in order to prevent the spread. There have been over 9,200 cases that have said that it is a challenge for us to do that. We need some additional support in order to make sure that the community is safe, that our households are safe, that our families are safe. So when you think about the pandemic, all of these hodgepodge of challenges come across, right? You have anxiety, you have stress. You're trying to figure out how you're going to stay away from your job for 14 days. How are you going to have some of these challenges? And the real challenges that are experienced are identified as social determinants of health, right? So these areas, when you think about people having health challenges, we don't generally think about discrimination in healthcare and occupation. But people with COVID-19, as well in the community, there is a difference between who is getting COVID, that people of color, people of low economics are having those challenges, and they face discrimination in multiple agencies to get housing, to get employment. So it may be more of a challenge to get health care because they don't have jobs where they have insurance, that they don't feel comfortable, or as opposed to going to the doctor to get primary care, that they utilize the emergency room in order to get the services that could be prevented if they had the right services. So occupations as well, in terms of the job and what are some of the challenges on the job, and even obtaining employment or maintaining employment maintains a high level of stress for those that we serve, and of course the possibility of losing housing. Although it was a moratorium in a lot of areas in the state of Louisiana in terms of housing and evictions, now that there is possible to evict across the state. So a lot of people have been behind because they have lost employment or they have challenges getting the hours that they need. So it exacerbates their stress level, their mental health, and their challenges with COVID-19 and staying quarantined. So the people we're talking about, right, are people, are everyday people, you know, like Mr. Rogers used to say, who are the people in your neighborhood, right? A lot of people that we encounter every day, they're at risk. They're at risk in the communities that we used to feel safe in, grocery store workers, social service agents. We go in people's homes. We go into the community, convenience store, child care. We have those challenges. Many of the people who are encountering live in low-income families, and they have a minor child at home. So if you're having challenges with behavioral health, if you're having challenges with COVID-19, and then you also have a child at home that has to go to school and work with them online, how can that increase your level of stress and anxiety? It does so insignificantly. And they have issues and fear about their own health, the people in their household, losing their jobs. They have difficulty sleeping, eating, those challenges. And then it exacerbates some of the health conditions that we have, such as high blood pressure, diabetes, things of that nature. And it increases the uses of tobacco and substance abuse. So as we look and we see that so many things are changing, as an organization, as an agency, as a community of providers, as Black social workers, interim president, all across the country, business is changing. The way we used to do business is no longer the way that we used. Let me emphasize, the way we used to do business in February, right, is much different from the way that we do business in October, because COVID-19 has changed the scope. And we're fortunate to have people in the community that are eager for the change, and we see positive signs in the change. So in traditional case management services, what do? We engage the client. We develop a relationship with them. We collect data. We find out, what are your challenges? What are some of your setbacks? What have been some of the things that you deal with? What are your strengths? Strengths are equally important when you're working with people, because if you can't find the strength in a person, you generally can't help them. So you have to look and help them identify some of their strengths. Even being able to survive and coexist is a real strength. We do an assessment on the information that's taken. We identify an intervention. What is the best thing that we can do to help this person reach the identified goals? We evaluate the progress. Are we reaching the goals in a time manner? What are some of the changes? Do we need to go back to the drawing board and find new things? And then we terminate. That's how we go from 1,000 clients to 700 clients, because we help people identify and reach goals. Additionally, we say, what do the people need? People for COVID-19, what are some of the challenges that they have? Many of them need food. The number one thing that we provide for those 9,300 cases across, they need food in order to be able to quarantine safely. They also need, some of them need housing, because if you are the son and you're a 24-year-old and you're living with parents who have chronic health conditions, you may need a place to stay, someplace that you can go so you can safely quarantine. Also, doctor's notes. People are fearful of losing their jobs, and sometimes people don't get terminated, but they get taken off the schedule and never get replaced. So that becomes a challenge. We also help people get personal protective equipment as well as safety information. There's a high level of misinformation. So how can we help people and work with people? And we do this throughout the state of Louisiana. We work with 911, we work with 211, and as the people are contacted, we reach out, and this is the new way we're navigating the system. You see here on this screen, you see over 20 people all across the state of Louisiana reaching out to individuals in their community to help make sure that their communities are safe and they have what they need in order to quarantine. And as well as have a relationship during these 14 days with someone who you can call, who's knowledgeable about the challenges you're going through and connected to resources that can help you identify them. We also take care of our own people. We know we need to be safe. We know they need to be safe in the community. We know we need modern technology. We know we need protective equipment. And we want to make sure that the people that provide the services, when they're in the community, when they're working, that they're safe as well. Additionally, we also noticed that there are new opportunities. We want to make sure that clients can continue to get services in the home. Telehealth was not even allowed in behavioral health for a lot of services that provided. Now we see that telehealth and audio health, just talking to somebody and hearing them know you and know how to address your issues is extremely helpful. So that's what we do, and these are opportunities and strengths that we see in doing the work that we do. So, I reached out to the people who I work with on behavioral health, and I reached out to COVID, and I said, give me your best success story. Well, the good news is I got over 25 success stories in 2 days, right? And so I know marketing's going to call me and say, where are those stories? We have great stories for people who are living lives. But what's more important is that the practitioners define it by the definition of the client. Success looks like for one person definitely doesn't look the same for another. And it's important that we tell the stories of what success looks like so you don't have higher expectations, like if you're not walking water, then you're not making a difference. There are more ways that you can make a difference in people's lives. So here we have William and Mary, and yes, that's their real names, right? So these are not their actual real pictures, but their stories are both very stressful and very different, right? Mary is a single mother of 2 children. She's had stable housing. She lives in a permanent supportive housing program. She has a very fixed income. She pays little rent, and she was able to maintain her housing. But the depression had kicked in. It was enabling her ability to take care of her children at times. She didn't want to take medication, but through encouragement with the practitioners, she was able to understand what those challenges were. So Mary had to go through for quite a few years to identify what she can do and what needs to be done in order for her to get the services that she needs and to get the quality of life that she was seeking. So about 3-4 months ago, according to the story, what happened was Mary made a decision last semester that she was going to go to college and get a certification. And she went to get a certification, and she worked very hard her first semester. In the first semester, she received a 3.0. The second semester, during COVID-19, she maintained a 3.5 GPA, and she was able to get a scholarship. So even though her children are at home, she's happy with the quality of her own life. She can support them. She's looking forward to making a quality living, reaching the goals that she set a long time ago that she thought she could not obtain. William had big challenges. William was living in his car. He lived in his car, he lost his housing, he lost his job. He lived in his car for about 6 months, and then he lost his car because he was parked in the wrong place and his car was taken. The whole while that his car was taken and he was on the streets, living in shelters, he was in the permanent housing waiting list. So he was working with the case manager who was trying to assist them to get the services that he needs in the interim. So while he waited for services, waited for housing, he was able to secure employment. He still was staying in the shelter, and about a year ago, he was placed into permanent housing. And he is most eager about having his relationship with his case manager, although she's been trying to terminate the relationship because William is doing well. He's stably housed and he's employed. So because success looks different and it looks different for different people, how do we know that it's working? What does it look like? People are responding to engagement. They're accepting treatment. They've identified barriers as well as strengths that they have so they can move forward. We identify an action plan. They work toward that action plan, but we understand that working toward the action plan, there are going to be challenges, and we're going to be with you throughout those challenges to help you reach those goals. We see that people have taken medication. We also see continued treatment for services and of course, stabilized housing and employment. We want to work in the community. We want to help people have better lives and new goals so we can obtain the most quality outcome that there is. And what we want for every one of our clients is to have a better health and to have a better life. We work with many people across the city and across the state in order to help them reach that goal. Thank you very much for listening. It's easy to talk about something that you love. I love working in the community, and I have a great time at Volunteers of America working with the most vulnerable people.
Thank you so much, Melissa. That's great. You know, and I think of your title as Director of Supportive Services, and it really comes through to me when you share that that's what y'all do day in and day out, whether it's supporting people staying housed or supporting people as they quarantine through COVID-19, through our new COVID Care Resource Coordination Program. Supporting people in their lowest moments is what you do day in, day out. So thank you. We're now going to turn to State Representative Royce Duplessis from House District 93. One thing that I'll note before I get into talking a little bit about Royce is that House District 93 encompasses 1/3 of the clients for our behavioral health, our behavioral health clients from the last fiscal year. So the folks that live in Royce's district know Volunteers of America very well and know the services that Melissa provides. You can look at the flyer for this event for Royce's official biography. He's done many great things, but the thing I'll note about Royce is that he really is a man of the community. He really is a community pillar. He's a husband and a father, and that is something that is really important to him. And he is rooted in the New Orleans community. So I'm going to stop there so that I can let Royce take it over. And Royce, you know, I really want to hear from you about how does state policy impact the things that Ms. Haley was talking about. I really look at that social determinants of health slide and think there's a lot that state policy can influence in terms of those social determinants. So go ahead, take it away, Royce. Tell us what you thought of Melissa's presentation and any ways that state policy has responded to the challenges of this year.
Thank you so much, Nick. Before I dive into it, I can't begin to just thank Melissa for her outstanding presentation. I'm sure others can relate that they found it inspirational just from her passion. Melissa's always been a very passionate person, and just her love for the work that she does certainly inspires me. So I'm just grateful that she's at Volunteers of America. I'm thankful for her leadership and her advocacy for advocating for the least among us in our community and providing those services at really on the front lines. And I also just want to take a moment to acknowledge Jim Leblanc, who I haven't had the opportunity to meet, but I feel like I know you because I've been seeing you on commercials for decades with the car donation program. So I don't know if I'll be seeing you do that anymore because you're retiring, but thank you for the great service that you have been doing in leading this organization. Melissa's presentation covered a lot, and up at the state capitol, which we're in legislative session now, Nick, you know, because you worked up at the capitol, and that's how we originally met. But we're covering a ton of issues right now. We're currently in our second special session that, quite frankly, I don't think we should be in right now, given everything that's going on. And if we are going to be in a special session, we should be focused on more narrowly tailored issues. But just kind of starting at the level, at the highest level, I would just kind of point out the importance of expanded Medicaid and how that continues to be an issue that's debated for some reason, as though we haven't been able to measure the immediate and incredible impacts that it has had on over 500,000 Louisianians. That's just across the state. And I know that that number is that has a direct impact on the work that you all do at Volunteers of America, making sure that folks have access to the services that you all provide. And it's so important that we ensure that that Medicaid remain expanded, that access is there so that individuals can receive these services. So just from a state policy standpoint, I just want to point that out, that the current governor, when he was first elected last term, this was one of his first acts, and it has just had what I believe to have been a tremendous impact. So it's important that we keep that in place, despite the fact that it is currently still being debated at the national level and litigated on an ongoing basis. You know, Nick, you talked about my involvement in the community and kind of how I approach this. You know, one of the reasons I chose to run for public office is because I'm a firm believer in equity and a firm believer that everybody deserves a fair chance. And I'm reminded every day that I walk into that Capitol and I see the policies that get the overwhelming support and the policies that don't get the support. I'm reminded of how so many people throughout our state, especially in New Orleans, don't even have a fair chance. Simply do not have a fair chance based largely upon the zip code in which they were born. The district I represent, District 93, encompasses probably the majority, the overwhelming majority of the homeless population in New Orleans. So you mentioned the 1/3 number, Nick, that Volunteers of America may serve, but my district encompasses a tremendous number of people who live or who are living in poverty. And the policies that impact the economic policies, let me be very clear, the economic policies that are passed at the state level have a direct impact on the economic outcomes of those at the lower end of the economic spectrum. And that is directly connected to the stress levels, to the anxiety levels, all that was covered in Melissa's presentation. But when we're up here advocating for policies like raising the minimum wage, it's not just purely for the sake of saying we want to see people have more money in their pocket, but we know that this has a direct effect to their overall well-being and their overall health. And so these policies have, like as you mentioned, are social determinants of health. Tying it more to the COVID discussion, once these numbers started becoming revealed in March and April, that the overwhelming population of individuals who were being negatively impacted by this pandemic were African Americans. Well, I felt like we couldn't just stop the conversation at that by saying, okay, people of color, you all need to take certain actions and try to avoid spaces. No, we had to go to really the underlying issues. And again, I don't want to be repetitive and cover Melissa's presentation again, because I think she knocked it out of the park in talking about those social determinants of health. Why is it that people of color are generally more likely to work jobs that are on the front lines or living in conditions where the homes are more confined, so it's harder to social distance. So, you know, those are all things that became apparent. And the question is, how are we as a state now going to respond to address these inequities? I know I don't have much time because I think I have maybe 5 minutes, you said, Nick. I may have already exceeded that. But I want to just even pivot slightly from the healthcare discussion and how we talk about social determinants to tie into how we have conversations around criminal justice. And if we don't reimagine our criminal justice system, we're going to continue to invest in, I think, in the wrong way. So yesterday on the House floor, we had a debate that we should not have been having. One of my colleagues brought a bill that would penalize cities and or municipalities who quote unquote defund their police departments lower than 10%, and they would then be penalized by not being able to get any state sales tax revenue or capital outlay money. So if we really unpack that, that is a terrible bill in and of itself. But if we don't start thinking about how to invest in social programs like social workers and mental health professionals and education and jobs and the things that we know actually will decrease crime and increase public safety, then we're just going to keep spinning our wheels. But the fact that we're having these kind of debates in 2020 is really problematic. So I think it's my job and my colleagues' job to be honest about these things and not bring legislation just to try to feed one particular political agenda, but more so get down to the root causes of crime and get down to really what's leading to too many of people who are being incarcerated, we know are suffering with mental illness, people who are dealing with behavioral health challenges. I need to work on that too. And rather than saying mental health, I'm going to start saying behavioral health challenges, as well as substance abuse issues and the like. And if we were serious about public safety, we would be investing more in social workers. We would be investing more in our teachers. We would be investing more in early childhood preventative programs that we know would direct people away from getting involved in issues that will land them in the criminal justice system. So I think those are really, really important points. And the last point that I'll make is I just think it's so important when we're having these conversations that we focus not just on outputs, but outcomes. And what I mean by that is we have to be able to tell the stories of those who are being impacted. And again, going back to Melissa's presentation, she even tied that in at the end of her presentation, how she gave actual examples of the students who had gone through certain situations in their life. We have to be able to tell the stories and make it personal. Because when we're debating policy and discussing it at a high level, I think it's easy for a lot of us to get somewhat disconnected. And if we don't have any personal understanding of how these policies impact us on a day-to-day level, then it's easy to continue to keep making the same mistakes. So the people like Volunteers of America, who are literally on the front lines providing services, I think are in the best position to help us achieve good outcomes by telling the stories of the people who are impacted. And I just think that is so very crucial. You know, I can say that myself personally and my family, we were tragically impacted by something that occurred not too long ago, a family member dealing with mental health and substance abuse issues. And I know that this is real. These issues are real, but the stories aren't really being told. And I think organizations like Volunteers of America play a key role in ensuring that families are getting the services that they need. So I really can't thank you all enough just for, number one, the work that you all do, but secondly, allowing me to be a part of this panel, because when I'm part of panels like this, it's not necessarily for me to share, although I want to share, but I gain a lot as well. And I gained a lot just from listening to Melissa's presentation. So with that, I will end my comments and turn it back over to you, Nick, and I'm more than happy to try to answer any questions that may come up later during the presentation. So thank you all so much.
Great. Thank you so much, Representative Duplessis, both for your comments today and for your service in the state legislature. Well, we really appreciate you taking your time, especially as you're in the midst of the special session. And we do look forward to you sticking around and helping during our question and answer session, which, just as a reminder, if you do have any questions so far, please feel free to put those into the chat. At this time, we are going to turn over to Chloe Wiley, who is the Foundation Initiatives Manager at the Blue Cross Blue Shield of Louisiana Foundation, to talk about how philanthropy is responding to the challenges of 2020. And, you know, Chloe, as I pitch it over to you, I kind of have the same question looking at that slide focused on social determinants of health, because I know that the Blue Cross Blue Shield Foundation sees those social determinants as important factors that impact physical health, and that looking at how we integrate services around responding to those social determinants is critical. But I'll let you take it from here, and thank you so much for joining us today.
Yeah, thanks for having me, and thanks, Melissa, for an excellent overview and for all the frontline work you're doing. I think you provided a great example of how nonprofits and service providers across the state are really getting creative to give people the services that they need in these challenging times. So thank you. And again, to the point around social determinants of health, it's something that we think about and talk about a lot at the Blue Cross Blue Shield Foundation. They're basically the social fabric that underpins someone, right? And what we've seen in these last couple months related to COVID-19 is that all those issues we knew to be true before were playing themselves out when we looked at behavioral health, looked at obesity, diabetes, or access to healthy food. They've proven even more true today. We saw long lines at food banks, gaps in people's abilities to access digital healthcare, digital education. Those are issues that were true before COVID, and COVID-19 has really shown a light on those issues. And we know that many communities that were already struggling are struggling even more today, making it all the more important that we as communities and nonprofits find ways to support those in need and support those underlying issues. You know, isolation and loneliness are social determinants of health. And it's really challenging to build those relationships when you can't do so in person. And so we've seen a lot of service providers really, like I mentioned, get creative to bring those services to families where they're in need in an accessible and effective way. Folks are really getting creative and experimenting. So in terms of how philanthropy plays a role, I think there's a couple things that come into play, right? So first, we learned really quickly that we had to be more flexible on our funding and our programming. For example, at the Blue Cross Blue Shield Foundation, we had to really pivot how we were giving out money. We created a new community crisis and disaster response grant. Originally, the board allocated $5 million, and after Hurricane Laura, when we saw even more supports needed, we allocated an additional $5 million, so $10 million total. So we had to be flexible on how we were giving out the funding and to whom we were giving it to. This allowed us to make the application process easier, so folks were accessing money quicker than our traditional grant cycles or grant programming. So that was number one. And number two, we had to really be flexible on supports that we were providing to our nonprofit partners. And really that revolved a lot around collaborative connections. So early on, we actually started a statewide funders connection call or collaborative call where twice a month we're getting together and talking about, hey, what are the needs in your community? Who are the nonprofit partners that you're seeing do really great work? And then how can we connect those people together to either share resources, learn best practices? So that's a huge way that funders can also play a role. We would love to give everybody money, but unfortunately that's not always possible. And so providing connections and sharing resources is another way that we can leverage the supports that we're able to give folks, even if it's not via funding streams. So that was a big lesson that we learned early on, is how can we provide folks different shared resources. We've seen nonprofits start to merge back office supports, really get creative on how they're combining efforts and combining resources so that they are covering gaps. There's not an overlap in services that are being provided with limited funding, especially in these challenging times. We've also expanded our array on like what we're giving money to, right? So currently under our disaster response grant, we've given roughly $8 million out to date. About 800,000 of that is around regional disaster relief. So community foundations, United Ways that are really tapped into who's doing the work that's needed and where. We've given about 200,000 to childcare and education, 800,000 to economic insecurity issues, up 1.4 million in food insecurity, because that's what we were seeing really heavily requests for in the beginning of the pandemic, and continue to see that today. And then in terms of healthcare needs, 400,000 hurricane relief to date. Unfortunately, we got hit really hard this year, which only compounded what we were seeing to be true with the pandemic and in terms of social determinants of health issues. We've given out 3.5 million to date. Mental health, 400,000. And then nonprofit sustainability, like general operating support, we realize is a huge, huge thing right now. Folks aren't getting as many donations. Fundraisers are having to be canceled. So we've had to really take a look at that and see how can we be flexible with our funding that's allocated to general operating as well. So lots of lessons learned, but I think the biggest thing that I can highlight is this collaborative effort that we're seeing from funders across the state, from nonprofits, really coming together to discuss, like, what are you doing, what's missing, and how can we combine resources to really make the most impact.
Great. Thank you so much, Chloe, for those comments. That's great. And we hope that we will be able to build from there, looking into our questions. So I'm going to get us started off with one question that has come in, and this one actually is for you, Representative Duplessis. The question is, when we look at the service gaps that exist in our communities, we often, as you noted on the House floor, see some rhetoric that is not necessarily connected to the reality on the ground. But how do we work and educate and motivate folks to work in a bipartisan manner to really respond to the challenges that exist? And is that something that is a realistic goal? And what should we all be doing in order to affect that change?
Thank you for the question. I think that is look, that remains the constant question of anybody who's involved in the type of work that I'm involved in, because if you are not constantly challenging that question, then it's really all for naught. And I don't think there's you're not really trying to make a difference, because you're recognizing the difficulty in perspectives and political ideologies and philosophies and backgrounds, and trying to challenge that every day, right? So you show up to this work, or at least I try my best to show up to this work with a level of optimism. And if I ever reach that point of feeling as though, well, there's really no hope or there's no chance, then then I'm not serving my district. I'm not serving the people who sent me here. I just use an example. Look, just yesterday, I had a bill that would have increased weekly unemployment benefits. Right now, Louisiana ranks second to last in weekly unemployment benefits at $247 per week. Nobody can live off of that, especially and that's just the max. Most people have been taken in significantly less than that. If you're unemployed, we're at $247 a week. That's the only state that's lower than us is Mississippi, but even there, the rate is higher. My point is that I brought the legislation yesterday, and it was unsuccessful. And how do we get past that? We keep having the conversation, because even though the bill wasn't successful, several of my colleagues who didn't even support the legislation publicly came to me and said, well, this is something that we do need to work on, that we will work on, and we're going to have to get more creative, and it won't happen overnight. But in terms of what we're talking about right now on the services, those service gaps, going specifically to the question, I think it goes back to really telling those stories and making it such that it's done in a compelling way. Because once people see how they are impacted, how their families are impacted, and how their communities are impacted, then I think you can see more of a response. Sadly, sometimes it takes that in order for there to be a reaction by those who are in the majority. But I think we just have to keep telling the stories and just not giving up and not being defeated.
Great, thank you. This goes. I'll address this first to Melissa. But when if we can imagine a future where we are past COVID-19, and we are looking at how we build back from this, what are lessons that we've learned? What are new things that we may integrate into service delivery going forward that we can take from this turbulent time?
Well, one thing that I believe we can learn is that it's important, and I know the word that they use now is pivot, to be able to successfully pivot. And I tend to use nimble, right? We need to be able to adjust from February to October as the needs change. And so I think we've learned to be focused on outcomes, like Representative Duplessis said, is to focus on outcomes and not be wedded to systems. And sometimes the systems once you see that they're not giving you the right outcomes, you have to make the adjustment. So I think it's important that we are not wedded to our traditional knowledge of what mental health services, behavioral health services, whatever terminology, what they look like. Because in February, you could not provide services that we provide over 400 a week to on the phone. So now we know it's keeping people out of the hospital. People are not going to jail. We have these abilities. So just really being able to adjust. And one thing, and I was about to write it in the chat, but it's kind of hard to do two things at once. But I don't know if this was by design. It certainly wasn't mine. But when you look at the formula that you have here today, you have providers, you have politicians, you have philanthropy. Those three P's equal power. And if we put those three things together, people who know how to do the work, people who can get legislation passed, and people who can help fund the work, our communities will be much stronger together.
Thank you, Melissa. I completely agree. And yeah, there was a little design to that. So
go ahead. Very good.
Chloe, I want to get your take on that same question. Any thoughts?
So again, it goes back to not reinventing the wheel. So folks are doing all these plans, creating all these new systems, and we've got to codify that and put it down on paper so that we can build upon that for the future and also share it. So nonprofits that may be in another region from you can benefit from it. I think there's real power in sharing so that folks can do the work faster. So that would be my only thing to add. I agree. And sometimes as philanthropists or funders, we're able to get money in the hands of providers quicker than the government pathway. And so we have to, that's really important. We have to recognize that and also think like, how can we partner to make that a more streamlined process as well.
Excellent, excellent. So partnership, another P, kind of pulling that all together. One other question that just came in. Do you think that telehealth will continue in some capacity once we get past COVID? So anyone who wants to jump in on that, feel free. Maybe Melissa, if we start with you, maybe the question would be, do you see some benefit to that in some form or fashion once we get past COVID, at least in part continuing telehealth?
Yeah, I think telehealth is here to stay. I think it made a grand entry and it will not make a grand exit. I think it's demonstrated that it works. What is going to be the challenge is getting people with lower income access to telehealth, because you have to have technology, you have to have hardware, you have to have Wi-Fi. So some of those things that are luxuries, many people who are in poverty don't have access to. So we have to get creative to almost, I remember, because I'm old enough to remember when nobody had cable, right? So now the systems are changed. We have to make this equipment standard in people's homes so they can access services immediately.
Nick, just one other thought to add to that. I think it's really critical as it relates to telehealth that we keep making this an issue for the decision makers and policymakers, because when this first came up, we worked very closely with the Louisiana Department of Health about getting the okay to move to telehealth. And of course, they had to get the okay from the feds. And that was critically important. But my fear is if any of this starts to lighten or pull back on COVID, there may be an idea, well, let's go back to the old ways. And I think what Melissa said, it works, and it works well. And even though we're a hands-on organization, I do think that sometimes we're just called to do things differently. And we've learned some good creative ways to still impact people's lives positively.
Yeah, absolutely, Jim. Thank you for sharing that. I remember those first days back in March where we were working to get that approval, and it's been so critical to our services. Well, as we're close.
Go ahead. If I could just indulge for 1 minute, you know, this is what I do for a living, is sell group insurance. And I had a group that put this in place, going back to telehealth, which you were talking about a little bit earlier, Melissa and others, is we put this in place about 8 years ago. The large employer went up the ladder and down the ladder in a week, and they bought it. That was when it was for sale. And it just made common sense from an employer standpoint, from an employee standpoint, from everybody's money saving. And so, you know, in fact, I applaud a lot with Chloe and your team over there at Blue Cross for coming up with a great product. In my opinion, this is something that, you know, the Affordable Care Act brought a lot of things that were really good. And one of those was the mandate for well care for free. What an ingenious thing. We should provide health care to all, at least one visit a year. Well, right. Why not bring in a mandate from the government? And I don't want to get into the politics of all of that, but this is something I think everybody could agree on is you know, providing telehealth for folks, you know, at a minimal cost or free. And that would help with the mandate of getting your one visit a year, perhaps, but also some other things that can lead to diabetes and, you know, things that you can just do a health visit online. So that's an area. I know, Royce, I think that there's some things going on in Baton Rouge. There's some chatter about, you know, mandates. And again, I know that a lot of people on the Republican side, especially, aren't really keen of, but I'd like to see these discussions continue on the state level, and appreciate some of the thoughts that you've shared today as well. And then hopefully on a federal level as well. Thank you all.
Great, thank you so much. And we have in the chat, yes, absolutely, a comment that intellectual and developmental disabilities service providers are really helped, and of course the people with intellectual and developmental disabilities from telehealth. So as we're closing in on time, I just want to pose a final question to our panel. And so we'll start with Melissa and go in the order that you spoke. But, you know, to send us off, as we're talking about behavioral health, we know that this has taken a toll on everyone in different ways. And so I just want to ask personally if there's a way that you practice self-care that maybe we can think about as we move forward. And then any closing thoughts that you would like to offer.
You know, self-care, I have gotten better at it. You know, our world changed as well. You know, I have 2 college students at home. That was not the plan, right? So how do you make the adjustments? And it has been such a great opportunity. But in terms of moving forward, I'm just extremely proud of Volunteers of America. You know, my boss, Boris VG, the Executive Vice President of Programs, and I work with heavy hitters, you know, Gerald Rooks in Veteran Services, Omega Lee in Intellectual Disabilities, Cheryl Lynn Hughes in Children and Family Services. These are people who are experts in the field. And I'm proud of the fact that we are committed to helping the most vulnerable people in providing quality assurance and to make sure they get the services they need. So I'm excited about the opportunity and that we're innovative and we're growing. So I think the future looks great for services as long as we're nimble and make the changes.
Great. Thanks so much, Melissa. And I'm going to turn it over to Royce and Representative Duplessis. As you reflect on that question, I've got a second question for you that came in through the chat. How do we spread the word and educate other legislators about the value of our services? You know, you said you learned some things here today. How can we do a better job of getting that word to other legislators? So that, and any thoughts on self-care, any concluding thoughts you want to share?
Sure. No, I think that the way that we spread the word is by continuing to put on panels like the one that we had today, and inviting my colleagues and other policymakers, not just on the state level, but on the local level too. And, you know, you may not get all of the responses or involvement, but you may get some. And that's a step, you know, that's a step in the right direction. So just continue to do the outreach. Look, Volunteers of America, you all are a time-tested organization. And the reason you all have been able to be so effective is because you have been doing that outreach. And you know, I certainly can't tell you how to do your job better, so I'm not going to try to do that. But I will just say, you know, sharing the information as much as possible. Once we get back to a place where we have this pandemic a little bit more under control, I would hope that more visits are made to the Capitol, which I think also makes our jobs a little bit more difficult in this virtual climate that we're in, because I think relationships and face-to-face contact does have a lot of an inherent value. So I'd say just keep doing the great work and let your work speak for itself. That way, when you do show up to the table to make asks or requests, you bring a level of credibility because you're doing the work. And I think that goes a long, long way. People are more willing to listen because you all are really the experts at doing the work, and you're not coming with any other agenda than providing the needed services. And that's something that I don't think should ever be political. But just in terms of the first question, I think, you know, that's a constant question I'm asking myself. In fact, at the beginning of this call, I was thinking about people like Melissa, who, in addition to doing the heavy work that comes along with her job, also has her own life, a husband and 2 children that she's raising, and has done a great job raising. But how do we make time to ensure that we're getting the care that we need? So in addition to serving as a state legislator, which a state legislator is a part-time job, even though it's full-time, it's a part-time job. I still have a solo law practice that I run, but I really find most of my balance by spending as much time with family as I can, being with my wife and my 2-year-old daughter. That's what really gives me the balance that I need. I bought an Apple Watch recently, and it has a little function on it where it'll remind me to breathe. So I guess it can detect when I need to slow down. So that is helpful as well. So I try to implement breathing techniques when I can, but I certainly need to do a better job of exercising and not internalizing everything that we see on the news or everything that we see on social media, because I think that can have a really negative impact on our overall mental and emotional well-being, and it will impact our ability to do our jobs at the highest capacity. So I try to tune out social media sometimes when I can. That's one way I think that also helps.
Great. Thank you so much, Representative Duplessis, and thank you so much again for being with us. All right, Chloe, absolutely. Chloe, we're gonna have you round us out here, and any closing comments you've got.
I would just say, in terms of self-care, like, social isolation is real, and it's really hard sometimes, just like it's hard for somebody to go to telehealth for mental health issues to ask for help. And so recognizing that in myself and saying, like, I got to pick up the phone and interact with people and friends. We've been working remotely for 8 months now, and so it's just me and my cat, so I've got to have some human interaction. And sometimes I have to make that effort. It's hard to do. And I think recognizing that that's hard for everybody during these times is important. And then last closing thoughts, to steal from Melissa, I think if the 3 Ps could just talk more to each other on a more consistent basis and share the what and the how, we could get things done a whole lot faster. Sometimes in our world, we're working in silos, and we're doing things and we're doing them quickly, but it could benefit a lot more, a lot faster if we would have these open discussions and these dialogues more frequently. So thank you all for hosting this. I think this is a perfect example of it.
Great. Thank you so much, Chloe, for being part of the panel. Thank you all for joining us. We really appreciate you taking some time out of your day. If you'd like to learn more about our services, what we do, you can go to www.voasela.org. Check us out on social media as well, but make sure to take breaks, as folks were saying. And let's all take a deep breath as we close off. I think that's a great idea. But thank you all again for being with us today, and take care.
Thank you all. God bless you.
Thank you.